Hello everyone. Let's talk about breast abscess. In university examinations, breast abscess can be asked either as a 2 marker or a 4 marker. And here I have taken the points from Marrow, edition 5. So let's see. What is breast abscess? Breast abscess means abscess formation in the breast, and it can be of two types, that is lactational breast abscess or breast abscess associated with duct ectasia. So one is lactational breast abscess, the other one is breast abscess associated with duct ectasia. Let's discuss one by one. First we'll go for lactational breast abscess. This lactational breast abscess is happening in the lactating woman. First point. What is the most common organism? The most common organism in the lactational breast abscess is Staphylococcus aureus. And the source of infection is obviously oropharynx of the child. So most common organism we know, Staphylococcus aureus, and the source of infection is oropharynx of the child. Now let's see what are the clinical features. We can imagine what may be the clinical features, like it is a abscess condition. So pain, fever will be there. Pain, fever and swelling. Fluctuation, coming to the fluctuation part, it is an examinatory finding, but it will come in the late stages only. So that is not so prominent feature. So for the main features are pain, fever and swelling. Lactational breast abscess in lactating woman. Most common organism Staphylococcus aureus. The source is oropharynx of the child. The clinical features includes pain, fever, swelling, and fluctuation can happen in the later stages. Coming to the diagnosis part, the mainstay diagnosis is through ultrasonography. Here you can see the picture. You can clearly notice the abscess formation from this USG. Now let's go for the management part. Coming to the management, the mainstay management is antibiotics. That is amoxicillin plus clavulanic acid, or cloxacillin can also be used. So the mainstay treatment is antibiotics. Along with antibiotics, you can give analgesics also to the patient. And now, in case of pus formation, you have to do the ultrasound guided aspiration. At least 2 attempts we have to give. And even after the 2 attempts, if it is failing, we have to go for incision and drainage with number 11 blade. Once again, I will repeat. In case of pus formation, you have to do ultrasound guided aspiration first. And we have to give at least 2 attempts, and even after 2 attempts, if it is failing, we have to go for incision and drainage with the number 11 blade. So after pus drainage, after incision and drainage, we have to suppress the lactation, because even if we are not suppressing the lactation after incision and drainage, there can be formation of fistula. So to prevent the formation of fistula, we will have to suppress the lactation after incision and drainage. To prevent the fistula formation by suppressing the lactation, we are giving cabergoline to prevent lactation. And in case of non-healing abscess, we have to suspect TB. As it is an Indian population, we have to first suspect TB, or we have to suspect inflammatory breast cancer. Just forgive me about the spelling mistake here. So it is inflammatory breast cancer. So in case of non-healing abscess, you have to suspect either TB or inflammatory breast cancer. And after incision and drainage, you have to suppress the lactation by giving cabergoline, because otherwise fistula formation can occur. Now, just coming to the second condition, that is breast abscess associated with the duct ectasia. It occurs in the perimenopausal woman. The first one is occurring in the lactating woman. The second one, the breast abscess associated with duct ectasia, it occurs in the perimenopausal woman. Now let's see what are the causes. The causes are anaerobic and aerobic microbes. Coming to the diagnosis part, the diagnosis is through ultrasonography, and you can see the abscess clearly in the ultrasonography picture. The management is same. We have to give the antibiotics, and here the surgery part is also there, that is Hadfield's procedure. So the breast abscess associated with duct ectasia, antibiotics we have to give, and the surgery here is Hadfield's procedure. So these are the things that you have to remember for 4 mark. I'll just quickly say once again all the features that you have to remember. You can revise with me. Breast abscess, there are 2 types. Lactational breast abscess, breast abscess associated with duct ectasia. First, we are going to talk about lactational breast abscess. Most common organism Staphylococcus aureus. Source of infection is oropharynx of the child. Clinical features include pain, fever, and swelling. Diagnosis is through ultrasonography. You can see the abscess there. Coming to the management part, management is antibiotics. And what are the antibiotics? Amoxicillin plus clavulanic acid. Amoxicillin plus clavulanic acid, amoxiclav 625 that you guys know already, or cloxacillin we can give, and we have to give analgesics along with antibiotics. And coming to the pus, if pus formation is there, the best thing is you have to do USG gated aspiration. If it is not happening, you have to go for incision and drainage. And after incision and drainage, you have to suppress the lactation to prevent fistula formation. And even after everything, if it is it's a case of non-healing abscess, you have to suspect TB or inflammatory breast cancer. And the breast abscess associated with duct ectasia. It occurs in perimenopausal women, and the causes are aerobic and anaerobic microbes. And diagnosis is same as the previous condition. It is through ultrasonography. The management includes antibiotics plus surgery. Here it is surgeries, that is Hadfield's procedure. So I guess with all these things, you guys understood what is breast abscess and what are the things you have to write about breast abscess when it is asked. So thank you everyone.